Specialty Associates is committed to providing a safe and healthful work environment for our entire staff and patients. In pursuit of this endeavor, the following video will review our hazard communication program, bloodborne pathogen training, and our emergency protocol procedures.
OSHA, the Occupational Safety and Health Administration, an agency of U.S. government under the Department of Labor with the responsibility of ensuring safety at work and a healthful work environment. OSHA's mission is to prevent work-related injuries, illness, and deaths. MyOSHA. MyOSHA is the Michigan Occupational Safety and Health Administration, is a state government agency that regulates workplace safety and health in the U.S. state of Michigan.
As we go through our workday, we touch a lot of surfaces, some of which might be contaminated. Millions of workers every day are at risk from contaminations called blood-borne pathogens. Blood-borne pathogens are present in infected human blood and certain other bodily fluids, and some of them carry potentially fatal diseases. No matter what kind of work you do, you should always be aware of the risk of exposure to blood-borne pathogens, because when you know the risk, you can take precautions. You can be exposed to a blood-borne pathogen by touching an infected person or their secretions, or you can be exposed by touching something that has been contaminated by an infected person. So how do you protect yourself? You have to understand that something can be contaminated and the infected organism may not be visible. For example, linens, tabletops, washrooms, door handles, anything that may have been used or touched by someone else can spread a dangerous germ or virus. When you come into contact with an infected surface, the organism can transfer to you. Once it is on your body, any body opening can allow this pathogen to enter your system. This includes your nose, mouth, eyes, other body openings, any mucous membranes, and any cuts, abrasions, or any other breaks in the skin. For example, if an infected person coughs or sneezes on a table which is not cleaned after use, and then you touch the table with your hands, the infection may now be on your hands. If you rub your eyes or eat anything, the infection can pass into your system. This can be prevented by following simple guidelines that will protect you from exposure. You don't know if someone with a contagious disease has touched the surface, so good hand washing is the first and most effective method to prevent spreading infections. Always treat blood, body fluids, broken skin, and mucous membranes as if they were infected, and use proper gloves before cleaning anything that may have been exposed. Wash your hands before putting on gloves and immediately after removing them. If soap and water is not available, you can use a waterless hand sanitizer. Never touch clean objects with contaminated gloves, and avoid touching your face, eyes, nose, or mouth until after you have washed your hands. Protect yourself from bloodborne pathogens, use appropriate disinfecting agents, and use proper hand washing techniques. Thanks for watching, and have a...
Bloodborne pathogens are microorganisms present in human blood, including HBV, HIV, and HCV. They also can include other diseases such as malaria. Exposure to bloodborne pathogens can be caused in a few different ways. The first way is percutaneous, which is exposure to tissue under the skin. This often occurs with needle sticks. Another type of exposure is mucocutaneous, which is exposure to mucous membranes, which could happen by splashing of bloodborne pathogens in the eyes, nose, and mouth. Also, non-intact skin, which is exposure to an area of the skin that is chapped or scraped. This could include acne and hangnails. Other potentially infectious materials, or OPIM, could include semen, vaginal secretions, amniotic fluid, saliva, synovial fluid, or most interstitial fluids. These are not very common at our practice, but just so you know, those that are not included or are not in OPIM include vomit, urine, feces, sweat, tears, spit. These are not considered a bloodborne pathogen unless they are visibly contaminated with blood or OPIM. Let's review some of the more common bloodborne pathogens that you might come in contact with. The first is hepatitis. It is inflammation of the liver. Many of the symptoms can be flu-like, which include aching muscles and joints, fatigue, loss of appetite, maybe some nausea and vomiting, jaundice, dark urine, light-colored stools, or rashes. The three different types of hepatitis include hepatitis A, B, and C. Hepatitis A is primarily transmitted via fecal, oral, foodborne, and bloodborne, although that's more rare. It can be prevented with a vaccine, and it can live outside of the body for months. Hepatitis B can be transmitted via bloodborne pathogens, sexual relations, or perinatal. It also is prevented with a vaccine, and it can live outside of the body at room temperature on environmental surfaces for 7 days. Hepatitis C affects nearly 3.9 million people in the United States. Its transmission is primarily bloodborne, and there's currently no vaccine. Treatment is effective in 10 to 40% of people. It can live outside of the body at room temperature on environmental surfaces for at least 10 hours, but no longer than 4 days. HIV is another very common bloodborne pathogen. It attacks the immune system and weakens human defense. Death results from the body's inability to respond to fight common diseases like influenza, pneumonia, or other infections. Its transmission is generally sexual, illegal IV drug use, or occupational exposure. It does not spread or maintain infectiousness outside of the body. The symptoms of many of these bloodborne pathogens can be similar. It's important to know the difference. Hepatitis B and hepatitis C affect the liver by causing inflammation, while HIV affects the immune system. Hepatitis B symptoms can show up like flu-like symptoms, fatigue, fever, weight loss, or diarrhea. Hepatitis C also has flu-like symptoms, and HIV includes fatigue, night sweats, diarrhea, weight loss, and opportunistic infections that attack the body. Let's review. How does the body defend itself against all of these bloodborne pathogens?
Pathogens, pathogens, pathogens. Those nasty disease-causing microorganisms. Luckily our body is made to fight, and has lots of defense mechanisms against these nasty invaders. In this video, we are going to look at some of the defenses our body has to protect us against disease. Let's start with our biggest organ. Which organ do you think that is? The liver? Brain? Lungs? Heart? Skin? Pause the video and have a think. Our biggest organ is in fact our skin. The skin covers the whole body, protecting our insides from physical damage, microbe infection, and dehydration. The skin acts as a physical barrier, which is difficult for microbes to penetrate. But that's not all. The sebaceous glands on our skin secrete acids, which make the skin acidic and prevents the growth of pathogens. So our skin does a great job. But what about the pathogens entering through our nose, mouth, or eyes? Tears, mucus, and saliva all contain lysozyme enzyme that breaks down the cell walls of many bacteria. Our respiratory system has many lines of defense, as well as the enzymes. Firstly, nasal hair keeps out dust and larger organisms, and then for the sneakier microbes that get through, there's a sticky mucus which traps them, and little hairs called cilia to sweep out the dirty mucus. Fall over and cut yourself? Luckily, our blood has its own defense mechanisms, preventing the wound from becoming infected. The blood contains platelets and fibrin, which cause the blood to clot and form a scab. You can learn more about this in our video on blood clotting. And don't you worry about swallowing pathogens. The hydrochloric acid in our stomachs is really strong and kills most of the harmful microorganisms that might be in our food and drink. Our defense doesn't stop there either. Friendly bacteria in our intestines stops other harmful bacteria taking over. If pathogens do get past our physical barriers, which is known as a general defense system, our second line of defense takes over. And this system is pretty feisty. It includes our white blood cells. Some of the white blood cells are called neutrophils, which hunt down, kill, and ingest pathogens. Other white blood cells produce antibodies, which destroy particular pathogens. You can learn more about this on our video on white blood cells. So there you have it, our defense system. It usually does a great job of keeping us safe and healthy, and when our defense system fails, modern medicine is there to help us out.
The Hazard Communication Program is required by OSHA. The Human Resource Administrator is responsible for coordinating and maintaining records of employee training with this program. Each new employee will watch this hazard communication training video prior to their initial work assignment. During this part of the program, we will review a few things. One is the written hazard communication program and where that's kept. We'll also look at our chemical inventory list, labeling of primary and secondary labels, material safety data sheets, or SDS sheets as they're now called, the required posters that we as employers in Michigan are required to have, training for all staff, a review of some hazardous and non-routine tasks that staff might participate in, and also our piping systems and how we maintain safety around those.
Safety rules and regulations that we know under the Hazard Communication Standard are now changing, including changes in the material safety data sheets, labels, and warning requirements. OSHA's Hazard Communication Standard, known as HAZCOM, will now integrate into the United Nations globally harmonized system of classification and labeling of chemicals. It will now be known as the Hazard Communication and Globally Harmonized System, or simply the GHS. The purpose of this video is to review the major changes that you're going to see. The GHS, or Globally Harmonized System, will now require chemical manufacturers to provide specific criteria to address health and physical hazards, as well as classification of chemical mixtures. Labels will be required to show much more information than before. For example, chemical manufacturers and importers must provide a label that includes a signal word, a pictogram, a hazard statement, and precautionary statement for each hazard class and category. What we now know as material safety data sheets are now going to be shortened in name and would be known simply as safety data sheets, or SDS, instead of MSDS. The safety data sheets, or SDS, will now have a new format that has 16 specific sections, ensuring consistency in presentation of important detection information. OSHA's Hazard Communication Standard is designed to ensure that information about chemical hazards and associated protective measures are disseminated to all workers. This standard has been revised to include the GHS. The major changes you should know right now are hazard classification. This replaces hazard determination. Hazard classification provides specific criteria for classification of health and physical hazards, as well as classification of mixtures. Labels. Chemical manufacturers and importers will be required to provide a label that includes a harmonized signal word, pictogram, and hazard statement for each hazard class and category. Safety data sheets will now have a specified 16-section format. In the new GHS, all chemicals will now be classified into three major hazard groupings. The first and the largest is physical hazards. This includes items like explosives, flammable gases and aerosols, flammable solids, gases under pressure, self-reactive substances that can react violently with water, and other solid substances that emit a flammable gas when wet, oxidizers like oxygen and hydrogen peroxide, and corrosives, which are either strong acids, strong bases, or concentrated solutions of certain weak acids or weak bases. They can exist as any state of matter, including liquids, solids, gases, mists, or vapors. The next major hazard group is health hazards. Examples of health hazards include acute toxicity. For example, hydrogen cyanide is a highly toxic substance. Acute exposure at relatively low doses can result in death. Skin corrosions or irritants can cause severe skin burns and/or eye damage. Another health hazard is serious eye damage or eye irritation, then respiratory or skin sensitization. Sensitizers can cause severe organ damage or major permanent functional changes in organ systems, for example, the lungs. Germ cell mutagenicity. These are chemicals which may cause mutations in the germ cells of humans, and then these mutations can be transmitted to offspring. Carcinogens. These are chemicals associated with causing cancers. Other toxic chemicals that affect the reproductive organs or other specific organs, and aspiration hazards. The third major hazard grouping is environmental hazards. This is new, and OSHA does not have jurisdiction over environmentally toxic chemicals. The labeling and SDS requirements under GHS require environmental labeling, but OSHA considers this portion of the standard non-mandatory, as environmental hazards are regulated by the EPA. Therefore, we will not be concerned with this area. It is being mentioned here for information purposes only. Let's talk about the Material Safety Data Sheet, or as we know it now, the old MSDS. The old MSDS has been found to be less useful in many circumstances because it did not contain enough information. The new Safety Data Sheets, or SDS, will replace the 9-part MSDS with a 16-part document. Although that sounds more complicated, you will find that much more information is being presented in a much better way. The SDS is product related, and although it is not able to provide information that is specific for any given workplace where the product may be used, the expanded SDS information will include much more data funneled down into a better document to help us understand the chemicals we are using. The SDS will enable people to develop an active program of worker protection measures, including training that is specific to your individual workplace, and to consider any measures that may be necessary to protect the environment. Information in an SDS also provides a source of information for other workers, such as those involved with the transport of dangerous goods, emergency responders, poison centers, and finally, consumers. The new standardized SDS format will make finding hazard and chemical information on the SDS easier for both employers and employees. There is no set format to the Material Safety Data Sheet, and they can range in length from 1 page to 20 or more pages. The new Safety Data Sheet will contain only 16 headings. All SDS will be in this standard format, which will make it easier for all of us to find the information that we need for our workplace. The SDS headings, sequence, and content are similar to many of the items required by other regulatory organizations. Reviewing the headings gives you an idea of how comprehensive the information will be. In the new standardized format safety data sheets, the first thing that will be provided is an identification of the product or chemical. Next, the hazards within the product will be identified, and then the composition or other information will be provided about ingredients. First aid measures will be discussed, as well as fire fighting measures, and that will be followed by a section that discusses how to handle accidental releases. Handling and storage is the next category, and then the 8th category will discuss exposure control or your personal protection, what kind of PPE may be needed handling the product. Physical and chemical properties will be explained, followed by the stability and reactivity information, and then toxicological information. The next 3 sections, ecological information, disposal considerations, and transport information, are not required by OSHA, but may be included in the safety data sheet. And the last 2 sections will be regulatory information and then any other information deemed pertinent by the manufacturer or an outside regulatory agency. Here are the first 2 pages of a sample safety data sheet. Note the specific sections. All safety data sheets will have the sections or headings in this order and in this format. This will make finding specific information much easier. There is not a standard format for the GHS label. However, there are required label elements. The GHS label elements that you see here with an asterisk have been standardized and are directly related to the hazard level. The other label elements are defined based on common definitions. But these three elements, hazard pictograms, signal words, and hazard statements, are all hazard warnings and are required to be grouped together on the label. The symbols, signal words, and hazard statements have all been assigned to specific hazard categories and classes. On labels the GHS system uses, only two words, danger and warning, are used to inform the chemical user of the severity of the hazards of the chemical. The use of just two signal words is used to help simplify warnings and the labeling system. For example, thinking about the word danger, imagine yourself driving up to an intersection with a stop sign. This signals to the driver that this is a potentially dangerous intersection and that the driver is required to stop and look before proceeding through the intersection. If the signal word on a label is danger, the chemical user should understand that this is a highly hazardous chemical and they should stop and become familiar with all the characteristics of the product before proceeding. On the other hand, if the label contains the word warning, this is like driving up to an intersection controlled by a yield sign. The driver can proceed through the intersection with caution, as it also has the potential to be a hazardous intersection. However, labels that contain the signal word warning indicates that the severity of hazards of the chemicals are less than those chemicals classified with the signal word danger. Hazard statements are supposed to give the chemical user additional information about the hazard that is depicted in the pictogram. For example, if you saw the flame pictogram on a label for a flammable liquid, the hazard statement might be, keep away from fire, sparks, and heated surfaces. As stated earlier, hazard statements have been standardized and the chemical manufacturer, importer, or distributor is responsible for using the appropriate hazard statement or statements on the label. The other statements shown are more examples of standardized hazard statements. Pictograms are now required. Only 8 are required by OSHA, but a 9th may also be used to indicate environmental hazards. The labels for hazardous chemicals must contain one or more of the pictograms to illustrate the hazards of the chemical. The exclamation mark pictogram, when shown by itself on a label, is for chemicals that have toxicity levels that are harmful to humans but are not usually fatal. This includes chemicals that can be irritants to skin and eyes. For example, pepper spray is a skin and eye irritant, and many soaps, detergents, and cleaning products like ammonia and chlorine can be irritants. The exclamation mark pictogram will also be used to show skin sensitizers, acute toxicity, narcotic effects, respiratory tract irritants, also something that could be hazardous to the ozone layer. However, this would not be mandatory under OSHA. While the chemical hazards associated with the exclamation mark pictogram are a concern and precautions need to be taken, they are not as dangerous as the health effects or hazards associated with the health hazard pictogram. Health hazard means a chemical that can cause acute or chronic health effects in exposed personnel. Chemicals like gasoline, benzene, acetone, and products like brake cleaner or anything containing volatile organic compounds will have the health hazard pictogram on the label. When you see the health hazard pictogram, the product or chemical will fall under the list of potential health hazards, including the group mentioned earlier. The flame pictogram indicates the product or chemical has flammable or self-reactive characteristics or other hazards as listed here. This is the pictogram for all gases under pressure. Don't be fooled by the picture of the cylinder because it covers much more. This symbol includes all cylinders, propane tanks, natural gas tanks, refrigerated liquids, and many other products in this category. The chemical hazards associated with the corrosion pictogram are skin corrosives and can cause permanent eye and skin damage. This symbol, one that is seen commonly in the military, is one we don't see very often in private industry unless of course you handle ammunition, explosives, and so on. Oxidizers are symbolized by an O with flames on top of the O. The skull and crossbones pictogram is for chemicals with acute toxicity effects that are deadly and could lead to fatality if not handled correctly. The dead fish and trees symbol signals environmental information. This is non-mandatory under the OSHA standard as OSHA does not regulate environmental hazards. As we said before, the EPA regulates environmental hazards and the chemical manufacturer, importer, or distributor would be required to comply with EPA regulations in addition to the OSHA labeling requirements. Here is an example of the labels you may see under the new GHS rules. As stated earlier in this presentation, there is no standard format required for the GHS label, so the information may or may not be in the order presented here. In fact, you can anticipate that most labels will look different from each other. The thing you need to keep in mind is that even though labels will look different, the information they will be required to list on the label is the same, and you should understand how to read and use the data presented. Other items required to be on GHS labels include precautionary statements. These are phrases that describe recommended measures that should be taken to minimize or prevent adverse effects resulting from exposure to a hazardous chemical or improper storage or handling. The precautionary statements would be the same on the label and on the safety data sheet for the product. The product identifier. This is how the hazardous chemical is identified. This can be, but is not limited to, the chemical name, code number, or batch number. The manufacturer, importer, or distributor can decide the appropriate product identifier. The same product identifier must be both on the label and in Section 1 of the safety data sheet. The supplier identification. The name, address, and telephone number must be provided on the label. You may also see statements pertaining to any pertinent supplemental information. This could be information added at the discretion of the manufacturer or distributor, or it might be information required by another regulatory agency. If a chemical manufacturer, importer, or distributor becomes aware of a new hazard for a chemical they produce, they have 3 months to update the label and the safety data sheet for that product or chemical. For example, if new research finds that a product was recently found to be carcinogenic, the chemical manufacturer, importer, and or distributor will have 3 months from the time they are aware of the carcinogen health hazard to change the label and safety data sheet for the chemical to include the new health hazard carcinogen information. This presentation summarizes major modifications of the Hazard Communication Standard to the globally harmonized system. We are exposed to chemicals and chemical products every day. You can find them in your workplace, your home, in schools, hospitals, hotels, just about everywhere. Exposure to hazardous chemicals is one of the major hazards in the workplace. Knowing how to find and understand information on the chemicals around you will help protect you, your co-workers, and your families.
Specialty Associates, clinical managers are responsible for seeing that all containers entering the workplace are properly labeled and follow the globally harmonized system or GHS requirements. The RCSA Hazard Communication Program, Chemical Inventory List, and SDS books are kept in different locations depending on which office you're in. In Livonia, they are on the shelf located at the doctor's station, near the back hallway. In Brighton, they are on the shelf located in the hallway near the back entrance. West Bloomfield locates them in the consultation office. And in Ann Arbor, they're under the computer in sterilization. Another copy of the chemical inventory list is also kept in each sterilization area. This list includes all chemicals used at RCSA and the appropriate PPE required when using these items. Required postings at RCSA informing employees of where the SDS books are kept, as well as when and if any new or revised hazardous chemicals and corresponding SDS sheets come into the office, are kept near or at the SDS book. The Michigan Safety and Health poster, which outlines your protections on the job, is located on the Employee Information Board. All employees should be informed that an employer is prohibited from discharging or discriminating against an employee who exercises his or her rights to obtain information regarding hazardous chemicals used in the workplace. As an alternative to requesting an SDS from the employer can seek assistance from the OSHA General Industries Safety and Health Division at 517-322-1831 to obtain the desired SDS. A sign or MyOSHA poster will be posted with the address and telephone number of the MyOSHA division responsible for such requests. Before any new physical or health hazard is introduced into the workplace, each employee who may be exposed to the substance will be given information in the same manner as during the hazard communication training. Occasionally, employees are required to perform non-routine tasks. Employees will be trained in safety measures necessary when performing these tasks. It is the policy of Root Canal Specialty Associates that no employee will begin performance of a non-routine task without first receiving appropriate safety and health training. Let's review some of these tasks.
In order to change the suctions, you need to turn off the compressors. These are our suction traps down here. When changing those, you need to wear gloves and a face shield. You put the face shield on and you just turn your suction trap to remove it, and then you replace it with a new suction trap. This is done on a monthly basis.
The autoclave is used to sterilize instruments. Once it is turned to exhaust and dry, the pressure has returned to zero. You must open the autoclave and let it vent for 5 minutes to prevent any steam burn. In order to take the instruments out, you wear oven gloves so that you don't burn your hands. There are 2 ways to know if the autoclave is sterilizing properly. The first is a bag that you put in here. The bag will change, the little dot will change colors. And then second, there's a test strip that is ran through the autoclave and sent to a lab to confirm our autoclave is working properly.
So, in case you can't clearly see this sign that says unplug before emptying, which is very important because it will eat your fingers off completely. You first want to turn the machine to off and clearly crawl under to find the other end of your plug. Unplug it from the wall. Proceed to empty your shredder. Now you can reach in, clean it, no problem, no loss of any digits. Once you're finished, find the end of your plug once again. Plug it back into the wall and proceed to turn the power. Still have 10 digits.
So typically in all offices, anywhere that you are going to need to climb to possibly get into a top filing cabinet when you're only 4.5 feet tall, you're going to need a ladder. You first want to make sure that that ladder is very sturdy and not wobbling back and forth. Get it good on the ground. And then make sure that you have a spotter. Dawn, could you spot me? I'm coming. I'm going up. What was that chart number again? I totally forgot.
8, 5, 3, 4, 2. You got it right there.
Perfect. Thank you. Coming down. Hold the handle on the ladder while you're going up and down for sturdiness.
Our piping and piping systems include labels that warn of proper safety precautions. These are included where the nitrous oxide tanks are located, as well as in operatories to alert employees.
Achoo!
OSHA requires employers to follow guidelines in order to provide the appropriate PPE to employees to protect themselves during work. Employers are required to complete a job hazard assessment form to determine any hazards that may be present. During the assessment, employers are looking for the possible hazard source, the body part it could affect, determining if PPE is required, and the type of PPE that might be needed. Employers then select the appropriate PPE needed and required to perform the job and communicate that information to employees. This assessment is done on an annual basis. Employers are also required to provide training to employees regarding when PPE is needed, what PPE is necessary, and how to put the PPE on, take it off, and adjust it if necessary. Personal protective equipment will be provided to employees at no cost to them. RCSA offers latex gloves, nitrile gloves, Kevlar gloves, face masks, goggles, face shields, disposable gowns, and hair bouffants. PPE is located in the sterilization area and can also be obtained by contacting a clinical manager. Let's review the proper way to wear, take off, dispose of, and clean PPE.
So we have a lot of varieties of PPE, or personal protective equipment, that are provided to every employee in a lot of different sizes and brands. Most important thing when you come in the morning is to know that you're protecting yourself as well as others from bloodborne pathogens. So you want to start with getting your mask. Now, RCSA has multiple different kinds of masks that you can choose from. Every office is going to be a little bit different in the location where you find these PPEs, but everybody's very helpful. Just ask, they'll show you where it's at. As far as gloves go, there's also many different sizes as well as brands. Try on as many as you need to find what you're comfortable in. Not only with putting on, but taking off. Okay. So as far as the eyewear goes, there's many different kinds that are appropriate to wear depending on your situation that you're in our workplace. If you, for one, have a prescription pair of eyeglasses that you need to wear in order to see certain things you're working with, we have a lot of safety glasses that are larger that will go over yours to protect you from bloodborne pathogens when you're close getting in the saliva with patients and such. We also have regular safety glasses. Variety of different kinds too that are comfortable on different noses and different faces that you can try out, figuring out which ones you like, that are just shatterproof and really protect your eyes from any kind of bloodborne pathogens. As well as there's the face shield. This is more pertainly used when you're working really up close with our chemicals, as well as you just need more protection over your face versus just your eyes and your mouth with your mask. So, as well as all of these are disposable and changeable, so it's very important that, if you do get bloodborne pathogens on this anyway, in any shape or form, you dispose of it correctly and get it okay.
So, properly just putting on your PPE equipment, so this would be for a surgical procedure.
First, I've already got my cap on. You just want to make sure that the majority, as much as you're able to, of your hair is up and tucked away, so that way you're not letting anything risk falling into the surgical site there.
As well as a surgery cap, we have a couple different varieties. A lot of the doctors wear these. Most important thing is you can get all of your hair up into one or the other.
Next, we've got our gowns here. You think that you're putting it like a regular jacket, but nope, you want to just go ahead and flip it around there.
There's going to be a tag that you put on the inside up against you, and the whole idea is to cover whatever would be touching your instruments or your patient, so that you can properly dispose of it. You want to make sure before you go into surgery too, or any kind of procedure where you're wearing a surgery gown, that you do have it tied, so that way it's not falling off halfway through and you're not reaching back trying to tie it.
Your other two ties were on your stomach. Just tie them from behind there. Make sure your whole front area is covered there.
Yep. Once you have them on, you feel comfortable, you go and you do your procedure. There's a proper way to take them off. Even though you may not seem like you have saliva or bloodborne pathogens on you, there may be many that you don't see. Important when you're taking it off, when you untie it in the back, just make sure that everything that's on the outside of you is not going to touch your scrubs or the inside of you. So you want to try to take it off one arm at a time by pulling the sleeve inside out, and you use that inside out sleeve to kind of roll up the gown. That way you're not touching or exposed to any of the bloodborne pathogens that are on the inside. After you do such, you continue to roll it up, and you properly discard it in a waistband as such.
We have nitrile gloves available for anybody to use when cleaning dirty trays, and they are kept in this little cabinet right here.
Face shields are multi-user PPE. It is important to clean multi-user PPE after each use.
Anytime leaving a room, an operatory, or anywhere where you're exposed to any kind of bloodborne pathogens or hazardous materials, you want to make sure that you remove any kind of PPE that's disposable, that's contaminated. Your gloves are the most important. There's a certain way to take your gloves off when they are contaminated to make sure that you don't contaminate your own skin or others around you. Most important is to do the inside out method by taking one glove and taking it off inside out, and then folding it up in that hand that you still have the contaminated glove on. Now to get this glove on, you want to get your finger underneath of it, up against your skin where it's not contaminated, and pull that one inside out as well, and then disregard in a wastebasket.
Eye wash stations are a very important requirement of protecting yourself in the workplace. They're required to prevent burns and loss of eyesight. You should always consult your safety data sheets and chemical labels to determine if you see warnings such as causes chemical burns or causes permanent eye damage. If you see these warnings, you need an eye wash station in your area. Luckily, at RCSA, we have eye wash stations in all 4 offices. They have highly visible markings. They're on the same floor as working conditions. They have pure, clean water, a hands-free operation, maintain a constant water flow for at least 15 minutes, and have unobstructed access to the eye wash station. When conducting an eye wash in an emergency, you need to immediately go to the eye wash station after the accident. You flood the eye with water using your fingers to keep the eye open and as wide as possible. Water may be colder than the body temperature, which can be comfortable, but it is imperative to rinse for at least 15 minutes. If you wear contact lenses, remove the lenses as soon as possible to ensure the chemical is not trapped behind the lenses. Continue to flush the eyes to ensure the chemical has been rinsed away. Seek medical attention after irrigating for the required amount of time, and be sure to tell your manager. The RCSA Exposure Control Plan is provided to eliminate or minimize occupational exposure to bloodborne pathogens in accordance with my OSHA rules. The ECP is a key document to assist our company in implementing and ensuring compliance with the standard, thereby protecting our employees. The review of this exposure control plan includes determination of employee exposure, implementation of various methods of exposure control, including universal precautions, engineering and work practice controls, standard operating procedures, personal protective equipment, laundry, housekeeping, and safe work practices. It also includes review of the hepatitis B vaccination, post-exposure evaluation and follow-up, communication of hazards to employees, record keeping, and procedures for evaluating circumstances surrounding an exposure. Root Canal Specialty Associates uses the following list of job classifications to determine if that position has occupational exposure to bloodborne pathogens. Employees in Category A are reasonably expected to have blood exposure. Employees listed in Category B are reasonably expected to not have blood exposure. Those that have an occupational exposure include dental assistants, both full-time and part-time, patient care coordinators at all locations, and also our endodontists. Those positions with a minimal or reasonably expected to not have occupational blood exposure include business and administrative staff. Universal precautions is an approach to infection control. According to the concept of universal precautions, all human blood and certain human body fluids are treated as if known to be infectious for HIV, HBV, hepatitis C, and other bloodborne pathogens. Based on our employee exposure determination list, we have developed specific precautions, controls, and work practices to ensure every employee covered by the Bloodborne Infectious Diseases Standard has a specific understanding of how to control exposure. Engineering, controls, and work practice controls will be used to prevent or minimize exposure to bloodborne pathogens. Based on the positions and the tasks identified in the employee exposure determination portion, a review of specific engineering controls and work practice controls used at our facility will include the scoop method when capping needles, use of the blue rubber stop also when capping needles, files and instruments being cleaned using the toothbrush method, the use of a sharps container, the use of a biohazard container for soiled materials, and PPE equipment being provided, as well as a number of other safe work practices. Let's take a look at some of these controls and safe work practices in action.
There's two ways to recap an anesthetic needle, and the first way is to use the blue rubber stopper. So I'm going to take the needle cap off, insert the cap into the blue rubber stopper, insert the needle into the cap, and then just tap it and make sure that it's secure. The second way, if you don't have a blue rubber stopper, would be the scoop method. And so I'm going to take this off, set it down, insert the needle into the cap, and then just kind of use the wall to tap it back in. Tap and then.
When cleaning files and tapers, you always use the toothbrush method and brush away from you.
Okay, so items that need to be disposed into the sharps container are dirty needles, used anesthetic carts, dirty blades, solvent syringes. Those can all just go into the sharps container. And then, what else am I missing? And solution syringes. Okay. So the way to take off a needle, a used needle off of anesthetic would be you just turn it, and then you just drop it right into the sharps container. And then you take your anesthetic carp out, and you drop that right in as well. Okay, you always want to make sure that you use your henos when you remove any used blades, and you never want to retract anything from the sharps container. So then the way to take the solution needles are you just twist it, goes in. And then for a used blade, you want to keep it away from your body. You want to grab it at the tip, lock it in with your hemos, slide it off, and into the sharps container.
In an operatory, it is important to make sure all handpieces with burrs are facing toward the unit. This will prevent the burr from puncturing your body.
sure that you're properly washing your hands after so turn on your water, wait for it to get a little bit warm there, gather your soap, scrub your hands, just creating a good amount of friction there, clean your hands inside out there in between your fingers, roughly for about 30 seconds, just to make sure that you're getting all the bloodborne pathogens off of your hands there and getting everything super sterile. Grab your paper towel there to shut off your water, just making sure that you're not transferring any bacteria or anything. Finish drying your hands and then just discard their soap.
One way to protect yourself in sterilization is to remember there's no eating or drinking, no using cosmetics or lip balm, and do not handle contact lenses or touch your face or eyes if there's a reasonable anticipation of exposure. Waste disposal housekeeping is an integral part of the Employee Exposure Control Plan. Our regulated waste is placed in containers which are closable, constructed to contain all contents and prevent leakage. They're appropriately labeled or color-coded and closed prior to removal to prevent spillage or protrusion of the contents during handling. Regulated waste requires that all surfaces contaminated with blood or body fluids must be disinfected with cavity wipes. Contaminated sharps are discarded immediately or as soon as possible in the sharps container, and sharps disposable containers are available in all sterilization areas. Bins and pails are cleaned and decontaminated as soon as feasible after visible contamination. Broken glassware, which may be contaminated, is disposed of by wearing Kevlar gloves, proper PPE, and swept with broom and dustpan and placed in a sharps container by management. Use forceps to handle glass particles if necessary.
This is a sharps container. We use this to dispose of any sharps like blades and needles, dirty blades and dirty needles. When it gets to the fill line, you take this red cap off, you put it on here to seal it, and then this entire bin gets placed inside of this bin. There's actually some full ones in here if you want to get that. And then this lid goes back on top, and every 3 months this bin is picked up by Superior Medical Waste, and they leave this manifest.
Root Canal Specialty Associates launders all of our endodontist scrubs and will also arrange for launder services for any staff scrub uniform that may have been contaminated with blood. If you are faced with other contaminated materials, please contact your manager for proper disposal.
We have two types of towel, fluffy and flat. And when they're soiled and contaminated, we place them in here. And we have a laundry service that comes every week to clean them.
RCSA uses the hepatitis B vaccination as a point in protecting our employees. Those employees with occupational exposure and risk to bloodborne pathogens, including the hepatitis B virus, will receive the option of obtaining the vaccination series upon hire and prior to training. Employees will have the option to decline the vaccination if they have previously received the vaccination or decided that they understand and are willing to take the risks associated with contracting hepatitis B. It is important to understand how the hepatitis B vaccination works in protecting you against one of the most common bloodborne pathogens. The best way to prevent hepatitis B is by getting vaccinated. The hepatitis B vaccination is safe and effective, and completion of the series of shots is needed for full protection. The vaccine works by stimulating your natural immune system to protect against the hepatitis B virus. After the vaccine is given, your body makes antibodies that protect you against this virus. An antibody is a substance found in the blood that is produced in response to a virus invading the body. These antibodies will fight off the infection if a person is exposed to the hepatitis B virus in the future. If you choose to obtain the hepatitis B vaccination through Root Canal Specialty Associates, we will cover the cost of the 3 series of vaccinations. One vaccination will occur upon hire or at a later time if the employee had initially declined the vaccination. The next vaccination will occur 1 month later, and the last at 6 months after the first. Vaccinations will be completed in conjunction with a local medical clinic and will be coordinated with the Human Resource Administrator. If any type of accident or injury occurs at work, a manager should be notified immediately. The manager will help determine basic first aid, such as cleaning and flushing the affected area, using a Band-Aid, a steri-strip, or if use of the eye wash station would be helpful. If the injury requires additional medical attention, the manager will complete an authorization for treatment form to send the employee to our partner medical clinic. If an employee's injury renders them incapable of driving, or if the employee is in emotional distress, an RCSA manager will drive the employee to a medical center or local hospital. If a needle stick or puncture wound occurs in the workplace, the first step is to notify a manager immediately. The employee would then flush the wound, promote bleeding if possible, wash with soap and water, and bandage if necessary. If the source object is sterile and nothing beyond first aid is required, then no further action is necessary. If the source object is contaminated, the manager will assist in identifying the source patient. The root canal specialty associate treating doctor will speak with the source patient and ask them to go to the nearest medical center for blood draw. The patient will not incur any cost. All cost will be billed to root canal specialty associates. If the patient refuses to seek medical attention, then employees will follow CDC guidelines on following an exposure incident. The manager will complete an authorization for treatment form to send the employee to our partner medical clinic within 1 to 2 hours of the exposure. Once the employee has been sent to the clinic, the manager will complete the required documentation regarding the incident exposure. The medical clinic will provide the employee with a copy of the evaluating healthcare professional's confidential written opinion within 15 days after completion of evaluation. The written opinion obtained by the employer shall not reveal specific findings or diagnoses that are unrelated to the employee's ability to wear protective clothing and equipment or receive vaccinations. Such findings and diagnoses shall remain confidential.
So in the event that I possibly had a patient who was very upset with me and sitting here at my workstation and grabbed what some people think is a butter knife. However, it's actually a letter opener, and he was going to come at me with it. I could certainly reach under my desk. Along the back side is a button that you just hold in. Of course, you want to be discreet, and pull that towards you, and it sets off a silent alarm right directly to the police station, and then try to avoid the butter knife.
We have an active shooter. Stand by for further information.
Tragedies such as the 2007 mass shooting on the campus of Virginia Tech, the 2009 shooting at the Fort Hood, Texas military post, and the 2011 attempted assassination of Representative Gabrielle Giffords at a public appearance in Arizona are all examples of active shooter situations. An active shooter is an individual actively engaged in killing or attempting to kill people inside an occupied structure or outside in a populated area. In most cases, there is no pattern or method to their selection of victims. Active shooter situations are unpredictable and evolve quickly. It is important to be prepared for such an event. Make it a practice to identify potential escape routes and have a plan in mind, even if you are just visiting a facility. In the event of a shooting at your location, you must quickly determine the most reasonable way to protect your own life. You will need to determine if the best course of action is to evacuate or to hide. Call 911 when it is safe to do so. If there is an accessible escape route, attempt to evacuate. Be sure to leave your belongings behind. Help others escape if possible, but do not attempt to move wounded people. Evacuate regardless of whether others agree to follow. Warn individuals not to enter an area where the active shooter may be, and follow the instructions of any police officers. If evacuation is not the best option, find a place to hide where the shooter is less likely to find you. And be sure your hiding place does not trap or restrict you or your options for movement. Consider the difference between cover and concealment. Cover will protect you from gunfire, and concealment will hide you from the view of the shooter. Quickly choose the best option. If you are caught out in the open and cannot conceal yourself or take cover, you might consider trying to overpower the shooter with whatever means are available. To protect your hiding place, lock the door if you can. Block the door with heavy furniture, and close, cover, and move away from windows. Hide behind large items such as cabinets or desks. Remain quiet. Silence your cell phone and/or pager. Even the vibration setting can give away a hiding position. When you call 911, remember to tell the operator the location of the active shooter. If there are multiple shooters, physical description of and number of weapons held by the shooter, as well as the number of potential victims at the location. When law enforcement arrives on the scene, their primary goal is to eliminate the threat and stop the shooter as soon as possible. First responders will not be able to stop to help injured persons until the environment is safe. Knowing what to expect will help keep you calm and allow law enforcement to quickly neutralize the threat. Officers may arrive in teams with tactical equipment such as vests, helmets, and rifles. They will need to take command of the situation. Expect to experience officers shouting orders and even pushing people to the ground for their safety. It is possible that officers from multiple jurisdictions will arrive on the scene. When law enforcement officials arrive, it is important that you keep your hands visible at all times. Avoid making any sudden movements. Avoid pointing, screaming, and/or yelling. Put down any items. Immediately raise your hands and spread your fingers. Remain calm and follow instructions. Do not stop to ask officers for help when evacuating. Just proceed in the direction from which officers are entering the location. For more awareness resources, please visit dhs.gov/critical infrastructure.
Show you guys how we're going to properly engage your blue tip or maybe a yellow tip needle inside of your little blue holder. I'm going to call it. Turns out, oh my goodness, right over here. Yep, right here. Now stop. Okay. You your eyes under there. Get your eyes under there. Way under there. You gotta get closer. Get in there. Rinse those eyes. There we go. How wonderful. Oh,
Oh, what happened?
Now she's dead. Nope.
we gotta start over. I loved it.
Okay.
That's all I did next to you. Just smile. And go like this. Look at you, but it's okay. Ow! I don't know what to say.